In this hall, our pharmacists gathered to brainstorm on continuing education to improve their service delivery, focusing on scaling practice in alliance with high-tech integration.
Within your community pharmacies, you have a digital tool that actually captures your transactions, so that when you go to get a loan, you have documentation, you have a track record of your financial situation. How do you integrate into the healthcare system in a transformative network? I think that's the way the world is going with technology. So you must be digitally enabled, you must have some quality assurance, or some kind of system that ensures the drugs that you have, the supply chain, how you get it in your efficacy, and so on and so forth.
They examined ways of advancing community pharmacy practice through technology, collaboration, and expanded services with a clarion call to embrace their central role in the healthcare system.
Community pharmacy practice in Nigeria is at a crossroads. The environment is changing, patient expectations are evolving, and healthcare delivery is becoming more complex. In the midst of this, one fact remains constant. The community pharmacist is still the most accessible healthcare professional.
Pharmacist is first and foremost a healthcare provider, a lifelong learner, and a professional to the core. So we want to ensure that our practices keep getting better. So we come together like this once every year to empower ourselves and then equip ourselves to be able to deliver more.
Other speakers highlight the importance of leveraging on digital tools to accelerate health market development, moving pharmacists from the back of the counter to the front line of primary care.
In an era where technology is speaking, pharmacists must not be left out. One of the things we tell pharmacists, we're not an endangered species or profession. AI will not take pharmacy practice. But the pharmacist that is technologically advanced, that has AI and others to equip and at his or her fingertips, will be a better healthcare provider for the citizens.
Pharmacists need to empower themselves to ensure they have digital systems to connect to the healthcare system. That's the first thing. The two is that they need to collaborate. I've often said that nobody can solve the healthcare problems alone. We need to collaborate across sectors to be able to, develop and design the system that works for all of us.
According to the Association of Community Pharmacists of Nigeria, their main objective is for enhanced professionalism and better patient outcomes. Adeshegun Igab, LTV News.